So going hand in hand with the proposed regulatory amendment, the NHPD has come out with a proposed application management policy. Again, because they will be dealing with another perspective, another regulation, they will need to have systems and procedures in place to be able to effectively deal with the incoming applications, the existing applications, and now the need to issue and monitor exemption numbers. So the proposed application management policy will be effective if the UPLAR regulations come into force. The policy will be effective at the same time. If the proposed regulations do not proceed, then this management policy will come into force in the early fall. This policy puts an increased emphasis on complete and quality applications. And the applications for the purposes of this policy will be categorized as applications attesting to pre-cleared information and those attesting to non-pre-cleared information. So pre-cleared information is any form of information supporting the safety, efficacy, and or quality of a medicinal ingredient, a non-medicinal ingredient, or a natural health product that has been reviewed by the Natural Health Products Directorate and determined to be acceptable. So those are things like monographs, labeling standards, abbreviated labeling standards. If your product is attesting to pre-cleared information, your product is either complete and licensed or it's incomplete and refused. There are no submission numbers, no information request notices for products with attesting to pre-cleared information. And again, this is part of their proposed application management policy that will be coming into effect in the next couple of months. For applications attesting to information that has not been pre-cleared, all ingredients in the formulation must be in the Natural Health Products ingredient database before the application is submitted. Currently, you can apply to have an ingredient, non-medicinal ingredient or medicinal ingredient added to the database at the same time as you make your non-compendial application. This will be changing. All ingredients in your formulation will have to be in the database prior to your application being submitted. For medicinal ingredients, you just have to provide evidence that the ingredient indeed meets the definition within Schedule 1. So those are the active medicinal ingredients deemed to be natural health products. For a non-medicinal ingredient, you have to provide evidence that the purpose, whether it's flavoring or emulsifying or filling, for example, that those purposes are recognized within the Natural Health Products ingredient database. So again, applications attesting to non-pre-cleared information must be complete before the submission number is issued. There will be no early or evidence IRNs issued. Your application has to be complete. There can be no critical evidence deficiencies. If there are, then your application will be refused with a refusal checklist. If your application is complete, then you will be issued a submission number. So again, there's increased emphasis on the completeness and the quality of applications with this new application management policy. The NHPD has also proposed some performance targets for applications attesting to non-pre-cleared information as well as pre-cleared information. Again, these are proposed performance targets. They are not legal requirements. They are only internal policy targets for the Natural Health Products Directorate. So again, for products attesting to non-pre-cleared information, they're suggesting that you would get your acknowledgement notice within 40 days. They're proposing that they would be issued within 40 days of receipt. So this allows for 10 days for them to look at an initial screening to make sure your application is complete, and then an initial assessment of the evidence to make sure there are no critical deficiencies. This would then be followed by a full assessment, which they've allotted themselves 90 days. If IRNs need to be issued, they would issue them with a response time from the stakeholder of 45 days. So within approximately 175 days, they would be able to issue or refuse a license. So as you can see, they've got 175 days, which is just slightly under the exemption number time frame of 180 days. So the idea really is for the NHPD to be able to issue or refuse product licenses within 175 days and not have to go to the exemption number for new applications. Again, the goal is to increase the amount of pre-cleared information available to applicants so that they'll have more information to attest to, and it'll be a more efficient review of the application. They're also looking at developing performance targets for all application types. And another comment, there will be no automatic extensions for IRNs. They will be evaluated on a case-by-case basis. So if you need an extension, it's not going to be automatic. You'll have to have a good argument for it. And again, just to go back to this, applications that attest to pre-cleared information, they're looking at a performance target of 60 days, which corresponds to the legal requirement for compendial applications that they must be evaluated in 60 days as well. So for other applications attesting to pre-cleared information, if it's not a monograph, they're looking at a 60-day performance target, but again, not legally bound by that 60 days, whereas they're legally bound for 60 days for compendial applications. The third component that goes hand in hand with the proposed regulatory amendments with the application management policy is compliance and enforcement, and that's the ultimate goal, is to bring the industry into full compliance with the natural health products regulations. So this new compliance and enforcement policy that's being drafted will replace the existing compliance policy and guide. It will be broader in scope. It will be related to all deficiencies, all violations related to the Food and Drugs Act and natural health product regulations. So it's not just product-based. They'll be looking at violations such as GMP deficiencies. Again, it will be a risk-based policy. They've identified proposed levels of risk as being higher, those that may pose a risk, and lower risk. So these are the violations. So higher risk violations would be things such as products that are not licensed, products that make Schedule A claims, products that are adulterated, products that may pose a risk to health. A potential violation would be labeling contraventions, GMP contraventions, and products that are violations that are deemed to pose a lower risk might be things such as a technical labeling violation, potentially absence of a common name. So this policy is expected to come into effect in the summer of this year, with a 6-month transition period where they will be promoting compliance, and full implementation of the policy is expected for February 1st, 2011. So this policy is going to move forward regardless of whether the proposed regulatory amendment proceeds or not. So regardless of the regardless of the regulatory amendment status, this compliance and enforcement policy will be implemented in full February 1st, 2011. If the regulatory amendment goes through, then there will be an annex attached to the compliance and enforcement policy stating how the exemption number will be affected and how violations for products with exemption numbers will be dealt with. So post-February 1st, 2011, products without a license or an exemption number, if the regulatory proposal goes through, may be subject to compliance and enforcement activities. So the expectation of this policy is that all products on the market will have been issued a license, a product license, or an exemption number.